the presence of these endometrial-like tissue outside the uterus. And it probably affects 7 to 10% of women in the United States. And of women who have chronic pelvic pain, about probably more, at least 60% of those women, the cause is endometriosis. And in women who are infertile, it's probably the cause for about half of the women that are infertile.
You're listening to the Nutrition World Podcast, a show about navigating the intricacies of holistic wellness. We're a natural health food store located in Chattanooga, Tennessee, and we believe that optimal health and peak performance should be accessible to everyone.
Welcome to our podcast, our Nutrition World podcast. I am Cady Coleman, and I am one of the hosts of our podcast. I am co-owner of Nutrition World with my father, Ed Jones, and have my master's in holistic nutrition. And so excited to be here today with Dr. Tori Hudson. I am a follower of Dr. Tori Hudson for probably the last 12, 13 years of my life, being raised in this health food industry and being raised in more holistic health. She has been one of the people that I have followed and wanted to know more about her practice and more about how she goes about treating women in a more holistic way as an OBGYN. And so I want to hop in and welcome her, but I want to introduce her for a second with a bit of her credentials, and then we'll let her hop into it. So Dr. Tori Hudson, a naturopathic physician, graduated from the National College of Naturopathic Medicine in 1984. She has since served in the college in many capacities. She's currently an adjunct clinical professor and at NUNM, Southwest College of Naturopathic Medicine, and Bastyr University. So she's practiced more than 35 years. She's medical director of her clinic. A Woman's Time is her clinic in Portland, Oregon. She's director of product research and education for the line Vitanica. We're proud to carry that line in our store. She is also the founder and co-director of Naturopathic Education and Research, a nonprofit for accredited naturopathic residencies. So I could go on and on about all that Dr. Hudson has done, and I could speak for 5 more minutes on that, but I want to hop in and give her a welcome. And so thank you, Dr. Hudson, for being here today with us.
My pleasure, Cady.
Thank you.
Thank you.
So today's topic we want to kind of focus on is endometriosis. So just on an average day in our store, I would say we get about 400 customers a day. We're a busy health food store, and I'm thankful for that. But I would say on an average day, we may even get 5 to 8 questions a day on endometriosis. And so that's quite of a common subject. I'm starting to hear a little bit, more questions on and people asking for referrals to different OBGYNs around town. But I would love to hop in and just generalize what endometriosis is for our consumers here.
Basically, it's the presence of things that are only supposed to be inside the uterus. They find their way outside the uterus. So it's the presence of these endometrial-like tissue outside the uterus. And it probably affects 7 to 10% of women in the United States. And of women who have chronic pelvic pain, about probably more, at least 60% of those women, the cause is endometriosis. And in women who are infertile, it's probably the cause for about half of the women that are infertile. But, as there's other causes of pelvic pain and there's other causes of infertility. But I think those numbers kind of help to shape the impact of it and importance of it.
Definitely. So are you seeing it a good deal in your practice then, I guess, with those type of numbers?
Yeah, absolutely. I mean, in terms of just I wouldn't say it's a common complaint, people coming in just because they have endometriosis. A regular complaint or regular issue, but not as frequent as some other things. But in women who have chronic pelvic pain, yes. In women who have infertility, yes. And one of the things that finds a woman in my office who has you can't really diagnose endometriosis absolutely unless you've had a surgery. called a laparoscopy that sees it and biopsies it, and boom, there it is. So there's a lot of, you might say, clinical diagnosis. She has this symptom, that symptom, and that symptom. It's probably endometriosis. So there's a lot of that. But to actually really know for certain, it requires a surgery. So a lot of how women come who think or know that they have endometriosis come to me. Either the conventional treatment that they were given has not worked adequately, or she doesn't want to do the conventional treatment that is being recommended, or she's having side effects from the birth control pills, for example, which are typically the first line treatment.
Gotcha.
So those are kind of the basic reasons, and so we explore, the options of treatments, and from diet to nutraceuticals and botanicals to conventional prescription management, not just to try to suppress the disease itself, and generally that's with a progestin or a birth control pill, but also just managing the pain. So there's sort of like managing the pain or symptoms of the disease, and then there's managing the disease. And we have to do that in both natural medicine, we have to do that, and in conventional medicine.
Sure.
So sometimes, we don't want to get lost in the weeds of just, the big picture, but she's still in pain every day.
Right. So tell me, what is an underlying cause of endometriosis, in your opinion?
Yeah. Well, the interesting and challenging thing about endometriosis is that there is more than one cause. There's a lot of hypotheses. Well, I should preface this with that we don't exactly know. So there's a lot of hypotheses, and those hypotheses likely include more than one underlying cause. And so for one woman, it might just be one mechanistic pathway, but for others, it might be one or more of these possibilities. So, and this makes it complex. So with endometriosis, the mechanisms that have been identified is that there is too many prostaglandin E2s being produced, and maybe some other inflammatory pathway has gone awry, so they have the inflammation pathway, essentially. And then you have the growth factor. It's too much growth factor pathways. And then you have an immune system glitches, whether that's, not enough natural killer cells or not enough of another kind of T immune cell. That's another pathway. Another pathway might be what's called aromatization, and there's too much aromatization of androgens towards estrogens. There's also what might be inadequate cell death. So things, are growing and dying and growing and dying all the time. So it may be that there's a lack of proper cell death of these normal endometrial tissues, but they don't go through their life cycle in the way that mostly it does. And then that kind of leads to this spread of this tissue in abnormal places. There's even some other possible hypotheses. The long-standing one has been this idea of retrograde menstruation, which doesn't really pan out, but yet it kind of sticks around as a hypothesis. In other words, instead of shedding the lining every month out and done, there is some kind of backflow or retrograde flow of that tissue. There's some gut flora, gut dysbiosis hypotheses now emerging as well. Is that causation, or is it just an association? We don't exactly know. And then there's even iron overload might be a possibility. Another possibility might be too much vascular it's called vasculogenesis or angiogenesis, so that there's too much growth factors of these blood vessel growths. And then what you haven't heard me say yet is, well, what about hormones
Mm-hmm.
imbalance? And it's very common in, and too common for my taste. It's a very common point of view of an alternative medicine point of view or a natural or integrated medicine point of view that there's hormone imbalance or that there's estrogen dominance. And that is not played out in the research at all. And what in terms of a systemic estrogen imbalance or systemic estrogen dominance, what is true is that the endometriosis lesions themselves can express a local production of estrogen, and they can also express some dysfunction in aromatization. Another thing locally is endometriosis lesions seem to lack certain progesterone receptors in the lesions themselves. So I'm not talking about systemic though. So an approach that kind of that says, oh, you have estrogen dominance is at best incomplete, and at worst naive and just wrong.
Okay.
And so I think there's been a misdirect and an attempt to help people and help women with a disease that we don't know enough about, but just going this direction of hormone imbalance is either going to go nowhere or just going to go not nearly enough.
Gotcha. Okay. So for a lady that's listening right now at home and is thinking like, oh, I have a symptom that you meant, pelvic pain, heavier menstruation, is there ever any irregular periods that could go along with this, or does it not really affect the regularity of periods?
Yes, it can. It can affect bleeding in more than one way.
Okay.
It can affect bleeding in irregular, either the longer cycle or a shorter cycle. It could affect. It could affect.
The cramps,
menstrual
the
cramps
pain,
is the biggie. Yeah, the cramping during menses is the biggie, and then pelvic pain at other times of the month is sort of the second biggie. Bleeding changes not nearly so much, but in fact, if she has heavy bleeding, I would be thinking of 4 other things far sooner than endometriosis. But there is a condition, Cady, called adenomyosis, which is, you might say, a relative or a sister to endometriosis. So we talked in the beginning about how endometrium lining gets up and out into the outside of the uterus and in the tubes, on the outside of the ovaries, and even other places. In bad cases, you can get it on the intestines, on the bladder. But adenomyosis, the endometrium doesn't go up and out. It embeds itself into the glands of the uterus. And these women have pelvic pain, and they have they have menstrual cramping in particular, and they have heavy menses in particular.
Okay.
Those two things combination would lead me to think possibly adenomyosis, which is a relative. Sorry, adenomyosis also is only truly absolutely diagnosed on a surgery.
Okay.
By generally, and what I'm talking about there is actually removing the uterus and then looking at the tissue under a microscope. But ultrasounds now, a high-tech ultrasound can identify some suspicions of adenomyosis. It can also identify not endometriosis, but can identify what's called an ovarian endometrioma. So that's where an endometriosis actually causes a certain kind of ovarian cyst. I hope we're not getting too out there.
No, that's great. That's good information for sure. I know, I think when women are in a place of having menstrual issues or not feeling well with their cycles and whatnot, it helps to have information to kind of pinpoint what to go into their office and start asking about and how to describe things a little bit more thoroughly and all of that. So no, I think that's
For sure.
wonderful. So tell me a little bit more of like, you know, with endometriosis, then if it was diagnosed during that surgery, that would also be where it would be taken care of, like that, what process is going on at that
Yes.
point? Okay. Okay.
Right. So a laparoscopy surgery is, two little incisions, and they're looking through a scope
Mm-hmm.
out. They're not looking inside the uterus. They're looking on the uterus, on the fallopian tubes, on the ovaries, and they can see these certain characteristic lesions or growths, and then they see that. So there's a certain visual to it, and then they can also take a sample and look at it under the microscope. But yeah, then they remove those. They zap those with laser or cautery or actually, excision. So surgery is that kind of surgery. Laparoscopic surgery is sort of a gold standard for conventional treatment.
Okay.
But usually what comes first in conventional medicine for treatment is a suspicion of endometriosis. Oh, let's try progestins or birth control pills to control the illness and pain management. So that's and if that doesn't work and they don't have, then they would move on to laparoscopic surgery if the woman accepted that.
Okay. So tell me, if someone came in and said, I'd like to not go the route of birth control pills or surgery, is there a protocol that you would kind of start trying of nutrients and potential deficiencies, folate, things of the nature that you could speak about?
Yeah. Well, the first thing, so there is some reasonable body of published literature on natural agents in endometriosis. So when I approach this, I have one of the things I have in mind, okay, she's in pain today or is going to be in 2 weeks when she has her period. So I have to have a more short-term pain management plan. And then I have to have here's the plan for actually having endometriosis and trying to improve it, if not cure it. And then is it causing or associated with other problems like her infertility or her irritable bowel? So all those things, we have to juggle all those balls. The natural agents for endometriosis that have some published literature, there's one study on melatonin, 10 milligrams a day. There's one study, I believe only one study, on N-acetyl. So the melatonin idea, the melatonin is it stimulates antioxidant enzymes and is a pretty potent anti-inflammatory. So we have those two mechanisms as part of our complicated map of underlying causes of endometriosis. So we're targeting that. There's green tea. There's been a study on green tea, and it targets not only the antioxidant mechanisms, but remember I talked about unregulated, like this proper cell death is not happening. So EGCG or epigallocatechin gallate from green tea is antimitotic, and it also inhibits blood supply to endometriosis tissue. So that's called anti-angiogenic. So that's sort of how, and it can inhibit certain growth factors that are stimulated by estrogen. So green tea, generally I give about 500 milligrams a day of that.
Okay. And for someone listening, that's not going to be through drinking green tea, right? That's more for someone taking a supplement at a higher dose.
Yeah, I think you're going to have to drink way too many cups of green tea.
Okay.
Generally 500 milligrams of EGCG you might be able to get depends on the company and the label, but it'll have that listed on the back. What percentage of the whole is EGCG? And you want 500 milligrams of EGCG.
Okay.
The N-acetylcysteine or NAC, this was women who took 600 milligrams 3 times a day. And about half the women who were scheduled for surgery for removal of their endometrioma, that's the endometriosis causing an ovarian cyst, about half of them had such improvement, their cysts shrank in size on ultrasound, they had such improvement in their symptoms that they canceled their surgery.
Wow.
So NAC is working through activation of the immune system, and increasing glutathione levels, and therefore having a cytotoxic effect of those natural killer cells. There's also resveratrol. Resveratrol doesn't get enough usage in my book, and it's also a powerful antioxidant. It also has been shown to inhibit aromatase. You might vaguely remember I mentioned that early on, that aromatization is higher in women with endometriosis. So resveratrol inhibits aromatization, and it's a powerful antioxidant. Now, I think this has only been studied in rat models with endometriotic lesions, but it's pretty impressive if you look at that. And if we can extrapolate to humans, they say somewhere between 200 and 400 milligrams a day.
Okay.
And then there's some other considerations, maybe based like quercetin is anti-inflammatory, bromelain is anti-inflammatory. There's some other ideas out there. Botanically speaking, I would look at more like on a pain management level, managing, like antispasmodics, like wild yam, cramp bark is a big one on my list.
Okay.
Ginger has been studied in menstrual cramps, not endometriosis specifically, but we know ginger is anti-inflammatory. Mexican wild yam and cramp bark are antispasmodic. There may be some effect on just immune modulation with things like ashwagandha and angelica in terms of the pelvic area. I don't know enough about Chinese herbs to speak smartly about that. But the last supplement maybe I would mention is we talked about there are these glitchy pro-inflammatory mechanisms that are occurring. So omega-3 fish oils, like high dose, 3-4 grams a day would be on my list. And even turmeric, I don't think we have, I could look at my slide deck here really quick, but I'm trying to remember if there was, it might be based on mechanisms, but it might be based on mechanisms of endometriosis and then kind of extrapolating that to curcumin. But I'm trying to see real quick here, Cady, if there is a study on curcumin and endometriosis.
Okay.
I think not. I think it was more looking at laboratory mechanisms in endometriosis tissue samples in the lab.
Okay.
And showing that curcumin inhibited the growth.
Gotcha. Okay. Yeah, that's a wonderful list. So, if someone was sitting at home listening to that, would you want someone to start with a couple of those remedies, run at all of those remedies? I know that that's an individual basis too, and probably the level of pain they're in. As you were speaking, there's different plans depending on severity and levels of pain. For myself, I kind of run at things, and so that's a little bit of my personality. So it would be, maybe 5 or 6 remedies to see if that could really make a difference for me. But someone that was just hoping for a couple of remedies, they would choose out of that mix, or could you speak to maybe the 3 that you would start with?
Well, I would target as many of those mechanisms that we theorized or that we think are going on as possible. So you want not just the antioxidant, not just the anti-inflammatory, not just the inhibiting growth factor, not just the causing cell death, not just the increasing natural killer cells. So your instincts in this case are good in that we need to cover multiple mechanisms. And I mean, I've been doing this for almost 40 years now, and with endometriosis, I found way early on when what we knew was even less than now, both conventionally and alternative medicine wise, just targeting the hormonal piece was just really not working out at all. So I was like, what is going on? So I really pushed myself to learn more about these dig into this other research that's really showing these multiple mechanisms. So I prefer, if I were using the individual ingredients, I would definitely do the NAC, the melatonin, and something anti-inflammatory, curcumin, or resveratrol or fish oils.
Okay.
And then I like that EGCG. So I'd pick out 4,
Okay.
trying to target at least 4 mechanisms. But sometimes you get more than one mechanism out of one item, like melatonin. You get the antioxidant and the anti-inflammatory. But then, like, not everybody's going to tolerate 10 milligrams of melatonin.
Right.
They're just going to be they're going to have some side effects.
Sure. So tell me, do you have any feelings on castor oil packs at all helping with endometriosis, or do you use that in your practice?
Long ago, I did. I might say I've sort of moved on because I feel like we have research that has helped us move on, so we can now utilize natural agents that actually have some published research. I think for immediate pain relief, the castor oil pack could still serve a role. To treat the underlying cause, I don't really have any confidence in that.
Okay. So for anyone listening, a castor oil pack is, putting castor oil topically on the outside of the uterine area. So, applying it and then putting some type of flannel cloth or washcloth and then putting some type of heat source over it so that the castor oil is supposed to go into a deeper layer within the skin. And what is the theory behind it? Is it supposed to pull something out, or it's supposed to detoxify, or it just is helping soothe the pain in some way?
Well, I think that's a good question. What is the what does it do? I think in this case, it probably reduces a little bit of the immediate inflammatory state that's happening.
Okay.
And maybe you might say decongesting the area.
Okay.
And I also, admittedly, Cady, over the years, I've gotten, what will my patients do in a sustainable way? And not that many will do castor oil packs in a sustainable way, because it's just kind of messy. And
It is. I totally get that. You got to meet the patient where they're at. And if you suggest something they're not going to do, then it's useless. I used to do castor oil packs, but the castor oil is really thick and sticky. And then there's cleanup and everything. And, that works for some, but there's plenty that are not going to do that. So
you gotta have plastic on the bed and garbage bags and towels.
It's a thing. Definitely. So tell me, if someone, say they handle their endometriosis or they were to get pregnant, is it true that sometimes pregnancy can change the state of endometriosis to where it doesn't grow back after? It seems like I've seen that happen a lot. I don't know if there's science behind that.
Well, the first thing that I would think of is, was it really endometriosis?
Okay.
That is my first question. And then the other one is, it does not, from my understanding of the literature, it does not cure endometriosis, but the hormonal changes during pregnancy might improve, and postpartum might ultimately improve those growth factors locally in those lesions. And I remember when I was a kid, I'm 71, and that was, he was telling a teenager, well, when you get pregnant, this problem will not occur anymore, which is not really what you want to tell a teenager, I don't think.
No.
But the increased progesterone levels in particular that's occurred during pregnancy, that can counter some of that local endometriosis proliferation based on the estrogen receptors and locally, and that is why progesterone and progestin can be used therapeutically. But can it have a lingering effect? I'm not so sure. I'm just kind of taking a quick scan while we're talking here.
Mm-hmm.
Pregnancy, I can't really quite tell. So I'm not sure if I'm going to have any better answer than I've already
Okay.
stumbled about
Sure. No, that's good.
with.
So I'm so interested too in just your day-to-day life. Tell us a little bit about what it looks like, and are you still delivering babies? Do you do annual pap smears? Are
Oh,
you like, what's your day-to-day
I
life look
don't
like?
deliver
No delivering
yeah.
babies. Okay.
I don't deliver babies. No, I'm
Okay.
a naturopathic physician, and some naturopathic physicians can deliver babies if they're trained. I don't do that. Nor,
Okay.
I think I did 5 when I was a student. If that was enough for me. But my day-to-day life kind of looks like this. I'm in my office and seeing patients every
Okay.
day, and so I see patients in my clinic, A Woman's Time in Portland, Oregon. I co-own and formulate natural products for Vitanica,
Mm-hmm.
and we have over 80 products. And I do some writing still, and I have my blog that I write things and post
Yeah.
things for twice a month. But I also have a new book that just came out. It's called
Oh,
The
okay.
Menopause Companion. That actually I was the co-author with a writer, Sasha Davies. So people might be interested in that. And then my
Yeah.
old, been around a while, the Encyclopedia of Natural
Mm-hmm.
Medicine
That's my
does have a
favorite.
chapter on endometriosis.
Mm-hmm.
It does have a chapter on endometriosis, but it's outdated, of course, because that was like, I don't know, 15 years ago.
Mm.
So some of the things that we're talking about today are not in that book.
Okay. I do love that resource, though. I know, as you're saying, it's a little outdated, but to me, that's one of the best women's health books that I think has been written. So I thank you so much for that. Probably about 9 years ago had some strains of HPV that I've spoken about a little bit publicly, but obviously I'll speak about it here. And I looked in your encyclopedia book to see what your recommendations were, and I was thankful. I followed a large supplement protocol, and then I was able to find a doctor who actually did escharotic treatments, and so I flew 8 times to Chicago to get those done. So I'm quite thorough in what I'll do at links, to do that. But it was painting of my cervix with bloodroot and zinc and bromelain and turmeric and
Right.
all that. And so you were the first person I had actually read anything about that on, and it's been 9 years now and completely free of all those strains and all good, in that department. So thankful for
Excellent.
that research that you had. Yeah.
I'm glad to hear that story.
Yeah. Yeah. Thank you. So that really, that covered so much for me with endometriosis, and I hope it did for our listeners
Okay.
as well. Is there anything else that you're kind of thinking of as critical that we missed, or something that someone would really want to know before we wrap up?
Well, I would like to just put in a plug for there is a time and a place for conventional medicine, a time and a place for hormonal management. There's a time and a place for surgery. There's a time and a place for procedures, and and those things can be done in concert with natural medicine. It doesn't have to be natural medicine, or it can be a collaborative, integrative approach as well.
I like
And
that.
fortunately, endometriosis is not, a precancerous or cancerous condition. So we're not risking, something potential down the road that's going to risk someone's life if they don't get it taken care of. There might be more pain down the road, and there might be delayed fertility down the road, but it is something that people can try safely, these natural therapies.
Awesome. Thank you so much for that. And thank you for your time, Dr. Hudson. It was an honor. So I'm so happy we got to speak today. And maybe I'll see you again at another expo, or if you're speaking somewhere. So thank you.
Yeah, Cady, thank you for the opportunity, and I can tell you're sharp, studious woman. So thank you for
Thank you.
helping all the people that you're helping.